All right, today we're going to talk about Rosuvastatin, which you might know by its brand name, Crestor. It's a really common medication for high cholesterol, but its real strength comes from using it safely. So we're going to break down exactly how to do that, so you can get all the benefits without the risks. So, whether you just got a prescription for Rosuvastatin or you've been on it for years, this is for you. We're going to cover all the essential things you need to watch out for, so you can feel totally confident about your treatment plan. Okay. So before we jump into the rules of the road, let's start with the absolute basics. What exactly is Rosuvastatin, and what's it supposed to be doing inside your body?
At its heart, Rosuvastatin is a powerful tool your doctor uses to manage high cholesterol. It's part of a class of drugs called statins, and its main job is to help keep serious heart-related problems at bay. But all of that potential, all of that benefit, it really hinges on one crucial thing: using it correctly.
And that leads us right into probably the most important part of this whole discussion, the risk of interactions. It's a word we hear all the time, right? But what does it actually mean for you when Rosuvastatin meets something else in your system? Let's take a closer look.
I like to think of it like this. Imagine your medication is the star player on a sports team. An interaction happens when another substance, let's call it a new player, suddenly runs onto the field and changes how the game is played. Sometimes it's a small change, but other times it can completely alter the final score. That's why we have to know who else is on the field.
And here's what's at stake. An interaction can go one of two ways, and neither one is good. It can either block Rosuvastatin from doing its job, basically canceling it out, or it can crank up its effects in a bad way, which increases your risk for some pretty serious side effects. We definitely want to avoid both of those outcomes.
So, what are these other players we need to be watching out for? Let's get into some of the most common things that can interact with Rosuvastatin.
What might surprise you here is just how different these substances are. It's not just about other prescriptions. Even something you can grab off any shelf, like an antacid, Tums or Mylanta, can get in the way and make your medication less effective. And then you have supplements like red yeast rice, which can actually raise your risk of muscle problems. This shows you exactly why your doctor needs to know the full picture of everything you're taking. Let's just focus on antacids for a second, because this is probably one of the most common interactions, and luckily, it's really easy to avoid. The problem isn't that you're taking them, it's all about when you take them.
The rule is actually super simple. Just separate the two by at least 2 hours. So if you need an antacid, take that first. Then just wait a couple of hours before you take your Rosuvastatin. That little time gap gives the antacid time to do its thing without getting in the way of your body absorbing your cholesterol medication properly. See? Easy fix.
Okay, this is the big one. The question that comes up with pretty much any long-term medication. Is it okay to have a drink while you're taking Rosuvastatin?
Here's the key thing to get your head around. Both Rosuvastatin and alcohol can put stress on your liver. While it's pretty rare, Rosuvastatin can cause liver issues on its own, and we all know that heavy drinking can cause liver damage. So when you combine them, you're just increasing that risk. This is why it is so important to have a really honest conversation with your doctor about how much you drink. They're the only ones who can give you the best, safest advice for you.
Now, it's not just about what you're currently putting in your body. Your own personal health history plays a huge role in how you might react to a medication like Rosuvastatin.
Yeah, your body isn't a blank slate, right? Any pre-existing conditions can completely change how your body processes this drug, and that can make you more likely to experience side effects.
So if you have any of the conditions you see on this list, your doctor absolutely has to know about them before you start. Things like kidney, liver, or thyroid problems can really increase the risk of serious muscle-related side effects. It's also been noted that people of Asian descent might be more sensitive to the drug and often need a lower starting dose. And of course, it's a big no-go during pregnancy and breastfeeding.
Okay, so that was a lot of information, I know. So what can you actually do about it? How do you take an active role in all this? Well, let's put together a simple little action plan.
It really all comes down to this one thing. You are the expert on you. Your doctor, your pharmacist, they're the experts on the medicine. The real magic happens when you work together. Being open and honest is your single best defense against a bad interaction. So here's what that looks like in the real world. Definitely do share everything you take, and I mean everything, even that daily vitamin. And don't ever assume something is safe just because you bought it without a prescription. Be upfront about your lifestyle, tell your doctor right away if you notice any new side effects, and please never ever be afraid to ask questions. There is no such thing as a dumb question when it comes to your health.
And hey, before we wrap this up, I want to bust a very common myth. So many of us have heard that warning. Don't drink grapefruit juice if you're on a statin. But here's the fascinating part. While that's true for some statins, it doesn't apply to rosuvastatin. There's no known interaction. It's the perfect example of why it's so important to know the specific details about your particular medication.
And that brings us to the end of our guide. We've talked about what rosuvastatin is, the big things to watch out for, and most importantly, how you can be a true partner in your own healthcare. So I'll just leave you with this one thought. Based on everything we've talked about today, what's the one question you're going to ask your doctor or pharmacist next time you see them? Because that conversation, that could be the most important part of your treatment. Thanks for tuning in.